Let's talk about liver diseases that are caused not because of alcohol. They are called NASH, non-alcoholic fatty liver disease. It's the biggest cause of metabolic syndrome in United States. Over 3 million people are affected by NASH. What is NASH? NASH is basically accumulation of fats, lipid droplets or fat droplets in your liver. How does this happen? Generally, if you think about an alcoholic, what happens is when a person consumes alcohol, the excess alcohol is converted to fats, and because it has no other place to go, it gets stored in the liver, and then it impedes the function of the liver. In non-alcoholic steatohepatitis, what happens is the fat that accumulates in the liver is not because of alcohol, but it is because of dietary stuff, excess fat intake, excess carbohydrate intake, lifestyle, genetics, inflammation of the liver. A lot plays into it, and not everybody really understands why non-alcoholic fatty liver disease occurs. So let's try to understand it a little bit more. What happens when you have high sugar or fat food is that the body tries to store all of this sugar and fat into different organs. The first and foremost being your fat cells. There are fat cells that are actually enveloping all the internal organs. It's called the visceral fat. And if there is excessive visceral fat, a lot of times this fat starts draining into the liver, and the liver just takes it up and stores it in its cells, and it causes a lot of damage to the liver. The other way fats can accumulate in the liver is a process called de novo lipogenesis. So there is the liver makes its own fat, and the process is too much for the liver to handle, so it just accumulates all the lipids and stores in there. So there are a few ways, which and not always are completely understood, how non-alcoholic fatty liver disease occurs. The third way that I can think of that people have looked at is reduction of oxidation of fatty acids. So fatty acids or fats are actually oxidized in the liver to generate energy, heat for the body. But for some reason, if this process is reduced because of XYZ reasons that are not completely understood, that can also lead to NASH. Why is it important to study about NASH? It is important because if you think about it, liver is the most important organ in the body, one of the most important. It detoxifies the blood. It actually takes place, it actually produces glucose. So endogenous glucose production is done by the liver. So when you're not eating, the liver provides fuel for your brain cells and for all the rest of the body when outside source of fuel is not available. So the liver detoxifies the body. There is a lot that the liver does, and if fats get accumulated in the liver, it actually reduces the liver function. Severe cases of NASH can lead to scarring of the liver, which sometimes is irreparable, and extremely severe case may need liver transplant. So there have been many companies out there that are looking for drugs that can actually put NASH into remission. They're looking for drugs that can dissolve these lipid droplets in the liver or prevent their further accumulation, so that the scarring or cirrhosis of liver doesn't occur. But it's one of the most important areas of research in metabolism these days. A lot of gastroenterologists and endocrinologists studying diabetes and obesity focus on studying the liver function in human beings. So if you see a trial in your area that actually studies the liver function and works on reversing fatty liver disease, you are more than welcome to apply for these trials and participate in it.